Hey, my name is Dianca Kine, and I will be talking to you about candidiasis. Here's the introduction of candidiasis. I will be talking to you about it more than reading for word. So I'll give you extra seconds after I finish telling you about it so you can read along. Candidiasis is a fungal infection. It is caused by Candida. Candida is a yeast-like parasite fungus that can sometimes thrish. There are many different types of species of Candida that can infect the humans. Candidiasis can occur in the mouth, vagina, stomach, skin, and urinary tract. The main two that I'll be talking about is the oral and vaginal candidiasis. Oral is known as thrush and the vaginal is known as yeast infection. These two types are very common. Here are some statistics about candidiasis. Both oral and vaginal have more than 200,000 cases reported each year. Oral thrush is most common in babies and in people with immune deficiencies like HIV and cancer. And it also is common in elderly people starting at the ages 40 and up. Vaginal is more common in women. They say nearly 75% of women has had at least one yeast infection throughout their life. Also, men can have yeast infections, but it is very rare. Here are signs and symptoms of candidiasis. If you have candidiasis, the symptoms and signs may vary because there are so many different types and they can affect so many different parts of the body. So below I have some symptoms of oral candidiasis listed. You might experience pain while swallowing. You might have bad breath, burning mouth syndrome, dryness, or white tongue. For the vaginal, you may experience pain in vagina. Pain may occur during sexual intercourse or while urinating, vaginal discharge that resembles cottage cheese, and vaginal itching. Here are some causes of candidiasis. Candidiasis is caused by the excess growth of Candida, meaning that the infection is caused by a person's own growth of this type of fungus. These organisms are usually found in the mouth, throat, and vagina. A weakened immune system can cause Candida to build up, which can cause symptoms of infections. Candidiasis can also be caused by sexual intercourse. This is rare, but it can happen. Also, other causes of candidiasis can be due to antibiotics, pregnancies, uncontrolled diabetes, and poor eating and stress. How to prevent candidiasis. Candidiasis can be prevented in many different ways depending on the part of the body you're trying to prevent it from. In oral candidiasis, better known as thrush, good oral hygiene is a good way to prevent candidiasis of the mouth, since the mouth and the throat is the area where it is found. Study shows that mouthwash can help prevent oral candidiasis in people who are getting treated for cancer. You can prevent vaginal candidiasis by wearing cotton underwear. Also, you should avoid tight-fitting clothes and also avoid spraying perfume in your private area. Diagnosis. Certain types of candidiasis can be self-diagnosable and some can't be self-diagnosed. The symptoms of vaginal candidiasis are similar to other vaginal infections, so they can't be diagnosed by physical examination only. To diagnose vaginal candidiasis, doctors will take a sample of secretion from the vagina and test it under a microscope. With oral candidiasis can be diagnosed from its symptoms, and sometimes a healthcare provider will scrape the affected area and examine it under a microscope. Candida organisms are considered normal in the mouth, so a positive culture by itself doesn't make this diagnostic. Complications. Some candidiasis can lead to serious health problems if left untreated. If you have a weakened immune system or constant steroid use, or candidiasis can be life-threatening. Vaginal candidiasis is very common in pregnant women, which can cause complications in pregnancy. Treatment options. There are many different treatment options for candidiasis. For vaginal candidiasis, a single dose of antifungal drug or the appliance of antifungal cream for 1 to 7 days, and for 1 to 3 days can for the mild infections. These usually have a very high success rate. Over-the-counter products are also available for vaginal candidiasis. For oral thrush, unsweetened yogurt and antifungal medication can help. The duration of the treatment depends on the severity of the infection. Oral thrush usually responds to topical treatment. Prognosis. Most women with vaginal candidiasis respond well to treatment with medications such as these that are listed. The infection usually clears in 1 to 2 weeks of treatment. If the infection takes time to clear or recurs after treatment, it can be because of some other underlying problems such as cancer, AIDS or HIV, diabetes, chemotherapy, and etc. that weaken the immune system. Oral thrush improves rapidly when treatment is started within a few days. The doctor may prescribe an antifungal agent such as creams or lotions to be applied in the mouth. And also recurrent thrush may occur in people with cancer, AIDS, or HIV, diabetes, and those having undergone chemotherapy. Lastly, I will show you pictures of oral candidiasis and vaginal candidiasis. Here are oral candidiasis. As you can see, they have like white lesions on the tongue, and this one has like a white little lesion in the cheeks. And they're found in the mouth and in the throat for oral candidiasis. And here is the vaginal candidiasis, and as you can see, the white stuff do kind of resemble cottage cheese. And this will conclude my presentation. I hope that you all enjoyed and was able to learn something from it.